Hello and welcome to Community Health Worker Program Showcase for Virginia State, Tribal, Local, and Island Nation Health Department. So my name is Mongshi Kang. I am the Envision CHW Outreach and Training Coordinator, and I will be the lead facilitator for today's webinar. So while on call today, we do have a small list of operating agreements to ensure that we collectively build a safe space and welcoming space. So much of today's webinar is going to be content sharing. So we do ask for you to stay on mute and then use the chat as a way to communicate. And then also when you are doing that on the chat, we also want you to treat fellow attendees with dignity and respect.
All right.
So for today's agenda, we are going to be providing some Envision updates and then go into our CHW program showcase with our 4 presenters. And then we do have time for a Q&A section as well. And then we're going to wrap it up. So with that, I'm going to pass it on to my colleague Leslie to share some Envision news and webinar updates.
Thanks, Mungshi. Hi, all. I'm Leslie Wolf, a CHW ally and co-director of Envision. And it's really an honor to be here with all of you today to close out this chapter of Envision's history. So this marks the end of CCR-supported webinars through Envision. And we'd really like to take a moment to express our gratitude for the opportunity to hold space with the support of CCR funds from the CDC, and to all of you who showed up focused on improving the health of our communities with really a deep commitment to the CHW workforce. Since December of 2021, we have held 29 webinars with a total of 4,701 attendees, and over half of whom have been CHWs, which is a big thing to celebrate. And if you want to advance the slide, please. So these webinars were originally intended to support communities in responding to COVID-19. And we did that by covering a broad range of topics, from our very first webinar on NACHWA's playbook, which was focused on the playbook that advances CHW engagement in COVID-19, to today, where we're showcasing the amazing work happening at state, tribal, local, and island nation health departments. So our webinars have really consistently provided crucial content and information, guiding communities and building the capacity and resilience of the CHW workforce. And all of the webinars and accompanying materials can be found at envisionequity.org. And you can find them on the training tab under webinars and also at the resources tab. We did want to take a moment just to invite you all to please share any feedback with us in the chat on how the webinars have impacted you and your work. We know that giving folks an opportunity to share that not only helps to connect each other in the chat, connect with each other in the chat, but also gives us really valuable information, because while this is the end of CCR-supported webinars, it's definitely not the end of Envision. And so any feedback you give really helps to inform our work going forward. And we are really excited about the future, and we look forward to having our paths cross again. So we also want to make sure to invite y'all to please sign up for the Envision News to stay connected and continue growing with us. We are always growing. So continue growing with us throughout 2024 and beyond. And thank you. I will pass it back to Mungshi then.
We are gonna hear a little bit more about some of the things we're doing on myenvision. So I'm gonna give the floor to Yasmin to update us about that.
Hi, everyone. So nice to see you here today. My name is Yasmin Aftahi. I'm the Envision Resource Coordinator. And I want to talk to you about some sustainability resources and what that's going to look like moving forward. So I'm going to talk about this in a second, but we are continuing to celebrate the CCR work that we've done together through some live streams through the end of August, where CCR 2109 recipients who have been working on their sustainability plans are actually going to have 30 minutes within myenvision, our community platform, to share more about their work, their sustainability work, their communities, and essentially really just give the mic back to CHWs. So again, this is going to go through the end of August. If you're not already signed up for myenvision, we'll make sure that you know how to do that so that you can join and watch all of those great poster sessions. Also, we've been having them for the month of July as well, and those are recorded and posted to myenvision so that you can go and catch up on the great presentations that have already happened and hear more from some teams, some CHWs and allies in Ohio and other states who are doing this awesome work. So we could go to the next slide, please.
Thank you, Yasmin, for sharing. So we are really excited to have folks join us at myenvision to also learn more about what other states are doing or other health departments are doing with their CHW program. So if you're interested to hear more, please join us on myenvision. So for today's webinar, we are going to be focused on looking at how an online, like Envision's online platform could create connections across health departments, and then really learning how to strengthen CHW workforce across the country, island, and sovereign nations, and highlighting success stories of partnership between federal funding entities and CHW workforce. So with that being said, I want to remind you all one more time. So we did have folks trickle in afterwards when I was going over the interpretation control. So we are going to be, this first presentation is going to be in Spanish. So if you are an English listener, please go into your interpretation channel and select English. So we are going to be hearing from Malta Quesada and Esther Odero, who are CHWs or Promotoras de Salud from Puerto Rico and from the Medical Service Cooperation. So I am going to pass the mic on to the two of them to speak about their CHW program.
Good afternoon. My name is Esther Yari Otero. We are community health workers, and we are going to be talking about the strategies, work, and challenges of our sites in Puerto Rico where we work. We are going to be describing some of the objectives. We are going to describe in very briefly the context, socioeconomic context that is affecting public health in Puerto Rico. We are going to showcase our work as community health workers. We are going to be talking about our functions, experiences outside and inside our clinics, and some of the strategies that we are using to address the challenges. Puerto Rico is facing a very, very bad public health crisis for decades now. The following issues contribute to this. There is a very unequal distribution of the public health resources. So there is a reduction of spending from the government, state, and federal. There is an exodus, or there are a huge amount of health professionals that are leaving Puerto Rico or their jobs, and there is a limited assignment of resources for public health work. So this is the map of our island, Puerto Rico, and these are the pins mark the two towns where we work. We are 11 community health workers and we work for the Corporation of Health Services for AgriMed. Is a clinic and a provider that has been giving preventive and healthcare services in 4 towns in Puerto Rico. For purposes of this presentation, we are going to be only focusing in 2 towns here. The Arecibo, the town where I work, is one of the largest towns in Puerto Rico. And I have been having the opportunity to impact a larger proportion of our population, adults, children, homeless, a huge amount of participants in our program. I work in the Wago, is another town. Puerto Rico has 3 towns that are very, very large. Arecibo, the one where Malta works, this one where I work, and the third one is Aguagua. So this is 3. There are 3 of the towns with more land and population in Puerto Rico. So the economies are vast. These places are also very, very geographically diverse. There are hills, there are rivers, there is mountains. So there is a population of about 100,000 people, if we count the 3 of them. My town has a population of 35,000 plus, and our agriculture is based on coffee and fruits. And we have a very, 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 very diverse topography, and there are a lot of mountains and hills. So permanently our roads are blocked by problems in the very, very primitive roads. So we have a very diverse population if we talk about education. Most of the people have a very, very limited education. They have always had access to a primary or grade school. We also have huge challenges about with transportations because of the rains and because of the precarity or primitivity of the roads. And so this lack of access, this lack of good transportation limits our job immensely. Right now, we are working in 2 very important areas. I'm going to be talking about 2 particular functions, the ones that we do at our clinic and outside our clinic. I want to take kind of note that in the clinic, we work giving a lot of referrals and giving a lot of links and giving resources to our patients so they could access other health services. We also work the phone constantly in order to be able to get appointments and medical resources to these individuals. In June, we were able to do almost 2,000 orientations about the process of renewal, the basic health plan of our population. The circumstances that we have been facing in the last 5 years since Hurricane Maria and also other earthquakes, and of course the COVID pandemic. So we have been working on renewing the basic health services. That renewal took a lot of people by surprise, and they couldn't have access to renew it. So we took as our own work or job to start calling one by one of these persons and giving them orientation and teachings about where they can or how they could or renovated the basic health services for them. So for them to have access to preventive basic health care. Also, we also work with through Medicaid. we had the resources to visit patients that cannot leave their places of their living places, their homes, because they do not have mobility to be able to renew these services for them, so they can have an equal access to this preventive basic program. In our communities, we are constantly invited to health fairs. So we go there, we take vital signs, we take referrals, we assess different needs, medication needs, health, social needs, and we try to help with all that. We are also coordinators of tests, basic tests, or basic health care preventive exams to people that attend these fairs. We did a huge event lately in which we were giving AC1 tests to the general population. Also, we do a lot of workshops among the communities where we talk and educate and do health education to the communities about health, healthy lifestyles, change in lifestyles, nutrition, exercise, different resources, different education about chronic diseases, so forth and so on. And also, in all of these three types of events, if we identify a member of our population that does not have any access to healthcare, we take that individual and we try to connect that individual with the basic program of healthcare, preventive health available in Puerto Rico. Also, I want to also to mention that with those, especially with the workshops, healthcare workshops, we identify the people with chronic conditions that do not have access to healthcare and try to connect them with referrals. Of course, for in our work as a community health work promoters or workers, we have a ton of issues like everybody else. We have a chronic lack of resources, all types, social resources, financial resources, etc. So it's very difficult for us to get to the places where the most vulnerable groups of populations are located. Or, for example, in my town, in Utuado, there is a lot of needs. There are a lot of elderly that do not have any means for to get transportation, and the possibility for them to get to appointments or referrals. There is no public transportation, so that limits the resources that we can bring to our population immensely. So that prevents also from us to be able to get to other different members of the community. Of course, we also face lack of involvement or compromise or engagement from the community. What are the strategies that we have set in place in order to be able to break those barriers? So, permanent identification of the entities in our governments in Puerto Rico that have resources and funding. We established multiple collaborative deals with a lot of agencies, a lot of people that have a lot of power to solve problems in our communities, and with people that have had a lot of time and a lot of trajectory working with these vulnerable communities. We also promote our activities directly using social media, using TV, using radio, and etc. So we have here, we are going to bring a couple of examples of recent successes. We did a very good health fair. We call it Move and Live Happily. And we did it in a high school in Arecibo. We were in contact, deep contact with 191 people, and we also administered 34 immunizations. That was the April 4, 2024. We also did a workshop, a health education workshop in Utuado, and we did a lot of identify a lot of people and a lot of people without access to resources. We taught them, we told them how to get referrals. We linked them to social services, and all of this continues to be in process. For example, there is one particular individual with a very serious genetic diseases that we were able to establish referral to a genetics clinic, and all the transportation and all the social barriers access that he has in order to be able to go to those referrals. We got services for medications, transportation, food for this individual. So we in our communities face every single day several social barriers, social needs that we try to overcome to help them. In front facing this public health crisis in Puerto Rico, which is really, really hard in rural areas, us, the community health workers, are the most important factors so our communities can confront the disparities and inequality in the access of health in Puerto Rico. So we are absolutely pivotal. We have a very important role in our communities. Why? Because we are there in order to connect all these individuals in our communities with the resources and the health services that they need. I am thanking everybody here in this call today, especially my coworkers, my community health coworkers who work every day tirelessly to try to figure out how to do our work. So I am here in this slide. I'm providing you our emails. So for us, for you, in order to communicate to us, if you would like to communicate to us because you have any questions or concerns, or if you can help us. We use some references that have been published. So here are the list of references that we use in this presentation. Thank you very much.
Thank you so much, Esther and Malta, for sharing the experience from Island Nation perspective as well. So then I will pass it on to our second presenter, who is from Austin Public Health. Her name is Patrice Hatchett, and she's a community health worker and equity ambassador for the city of Austin and Austin Public Health. So Patrice, if you could come off of mute, and I'll pass it on to you.
Hello, thank you for that welcome. I'm so glad to be here with everybody. As stated, my name is Patrice Hatchett. I work as a community health worker and a community health worker instructor at the city of Austin, Austin Public Health, with the Heart ATX program. Slide 2. All right, so one of my goals I'd like to state first as a community health worker while working with community members and partners is to motivate and encourage community members to adopt healthy living practices, along with creating agency for themselves in an effort to live healthier lifestyles. So regarding the CCR 2109, the 3-year grant contributed to the city of Austin Public Health, her ATX program, by allowing us to render services by first hiring multiple community health workers who receive training on COVID-19 response, chronic disease prevention, and social determinants of health screenings and referrals. In our department, we provided outreach SDOH services by utilizing a platform known as Connect ATX United Way. So each CHW works in their assigned zip codes as of today, and we provide these services throughout the community, working with community members and community partners in outreach, where we're providing services by tabling in health centers, rec centers, senior centers, libraries, affordable housing settings, and we also participate in outreach, team block walking in neighborhoods, shopping plazas, etc. So as far as, next slide for me, please. As far as COVID-19, like many other organizations, we also receive training on COVID-19 response. Working on the Salesforce platform, we perform contact tracing and provided COVID-19 information through tabling events to educate the community. Next slide for me. Now, referencing chronic disease prevention. So we incorporated facilitating free healthy living classes with the focus on diabetes management and prevention. So with that, we provided those trainings using educational curriculums known as something called Dept. It's a diabetes empowerment education program. And also we provided DPP, which is diabetes prevention program. So to organize the classes, we have one-on-one conversations with community partners about partnering opportunities in efforts to provide these educational services. So the Dept program is free. It's a 6 weeks consecutive series offered to the City of Austin, Travis County residents. It consists of topics including what is diabetes, defining diabetes, diabetes medicine and management, diabetes and healthy nutrition, diabetes and physical activity, and our 6th class is diabetes and managing stress. So individuals are welcome to invite guests to participate in the class with them, and you don't have to have diabetes to participate in the classes. And so now I'll move on to our DPP program, which is also a free 1-year-long program with emphasis on diabetes prevention. To be eligible for the CDC's National DPP Lifestyle Change Program, individuals entering the program must be at least 18 years old, also have a body mass index of 25 or higher, or 23 or higher if you're Asian American, not have been diagnosed with type 1 or type 2 diabetes unless you have gestational diabetes, not be pregnant, and have a positive result on the CDC or American Diabetes Association pre-diabetes risk test, or have a blood test results that meet certain criteria. There's also something called the Medicare Diabetes Prevention Program. It's a program under DPP, which we don't participate in that program, but it's something that's implemented by the Medicare part of the DPP program. So like I said, we don't participate in that program, but for agencies that do, to qualify for the Medicare Diabetes Prevention Program, you must meet the following requirements. Also have a hemoglobin A1C test with results between 5.7 and 6.4. For those that don't know what A1C is, it's a test that's measured 3 months prior to you receiving that lab test, and it's to check for pre-diabetes or diabetes. And the ranges are 5.7 to 6.4. So if you go to the doctor will poke your finger, and then they will be able to tell what your blood levels have been the 3 months prior to that visit.
Sorry, Patrice, can I interrupt you really quickly?
Yes.
Can you slow down a little bit for our interpreters?
Okay, sure.
Thank you.
Thank you. So you also must have, for this particular MDPPP Medicare Diabetes Prevention Program, have a fasting plasma glucose test result between 110 through 125. And that's a fasting blood glucose. Not have been diagnosed with type 1 or type 2 diabetes, or have end-stage renal disease, or previously participated in the program. So concerning Connect ATX, this is another program that's been implemented by our division, and we use a platform called Connect ATX. And for those that aren't aware of it, or aren't familiar with Connect ATX, the platform allows us to refer and follow up, connecting individuals to various resources such as recreation centers or senior centers, churches, libraries, affordable housing settings, etc. And next slide for me. So we also had the opportunity to partake in the Photo Voice project. And my experience working on the Heart ATX Photo Voice project has been that I realized that even though I am not a professional photographer, I can still deliver good photos. So my goal for my photos was to tell a story that correlates with my experiences. My recommendation for others is to learn as much as they can about Photo Voice and to have fun with the process. I have had success with taking photos and expanding my knowledge with new ways of reaching the community to evoke a healthy behavior change by implementing the Photo Voice project. And so I also this year had the opportunity to participate in the Envision seminar and health talk that we had in Seattle, in Washington, Spokane, Washington, which was very informative. And I like the fact of collaborating with individuals. It was very informative. It was a collective effort to sustain the CHW workforce. And I think that's very important because as we're getting towards the end of the grant, a lot of people that are in the community health worker positions are having to pivot or transition into other positions or with other divisions or organizations. So it's great to connect to other people when out at certain events. So I really appreciated being able to meet others and hear their stories and all the great work that they've been doing. And so to end, I have covered our program in its entirety, and I would be willing to answer any questions you have at the end of the webinar. I would also like to reflect on the fact that we have come a long way since the beginning of the pandemic, and I believe that we all have learned a lot, quite a bit, and we learned from one another and we are still learning. I love the fact that as community health workers, many of us can stand and say that we have made a difference and have the ability and skills to sustain in representing our positions as successful CHWs. Can you go to the next slide for me? Thank y'all so much. I really appreciate your time. That's it.
Thank you so much, Patrice, and giving us insight of what you all have been doing in Austin. So we are going to move on to our third presenters, who is from Arizona. So I'd like to introduce you all to Luisa O'Mara and Ashley Lazaro. So I will pass it on to the two of you.
Awesome. Can you change the next slide? So hi everyone, we are the CHWs with Us team, which stands for Community Health Representative Workforce Integration and Tribal Health Systems. My name is Ashley Lazaro and I am the grants manager. I have Luisa O'Mara, who is on our NAU evaluation team, presenting with me today. Next slide. So to start off, here's a photo of most of our grant partners at one of our quarterly meetings where we usually take the time to talk about all of the great things each one of our partners are doing within their programs. It really is such a great time whenever we get together in person, especially since most of us do live hours away from each other. Next slide, please. So in case you aren't familiar with who community health representatives or CHRs are, they are community health workers who serve tribal communities across the country and are usually employed by their tribal health department or clinic or Indian Health Services. To give a little more background, the Arizona Advisory Council on Indian Healthcare and NAU have worked together to support the CHR movement for nearly 10 years. In order to continue the support of the CHR workforce, we applied for the CDC grant as a consortium of subcontracted tribes and NAU. We have intergovernmental agreements with the Hopi tribe, the Wallapai tribe, White Mountain Apache tribe, Salt River Pima Maricopa Indian Community, Hokopa tribe, and Gila River Healthcare. With that being said, we also have two mentor tribes, which are Navajo Nation and Colorado River Indian tribe. As you can see on this map, it shows the 22 tribes here in Arizona, of which 19 actually have CHR programs. And on the map, you'll see those green triangles. Those green triangles are our subcontracted partners. We really like to show this visual to show how spread out all of our tribal partners are. And I did want to note that although we partner with those specific tribes, we still connect and provide technical assistance to all of the other CHR programs in Arizona as well. Next slide, please. So for today's presentation, we really wanted to highlight some of the achievements that our grant cohort have done, which focuses on 3 areas. So we want to focus on training, integration, and sustainability. Next slide. Next slide. So starting with training, in the last 2.5 years, the training hub organized or directly provided 50+ trainings, which represents a variety of topics, engagement styles, and trainers. We've had folks from our agency provide trainings on topics that cover epidemiology, Medicaid reimbursement billing, and I've even provided training on how to create outreach materials using Canva. The training topics and modes are really determined by the needs of each CHR program, which is why you see pictured here on Excel and management. These are topics that are usually requested by our partners. Next slide, please. And so during the first 2 years of the grant, we organized 2 CHR policy summits, which each with 200+ CHRs, tribal leaders, tribal health advocates, IHS officials, and other stakeholders. These are important workforce policy summits that have actually been taking place since 2015, and they actually started so much smaller than they are now. And we are currently in the planning process for our next one this fall. So these annual summits provide a wide variety of trainings and learning sessions for our CHRs around the state and the country. They're also where the statewide Arizona CHR workforce movement was created, which is a coalition that advocates for the inclusion of CHRs in both state and national level dialogues around things like the workforce standardization, certification, training, supervision, and financing. Next slide, please. And so now I will pass it over to Louisa, who will talk more about the integration efforts from our partners.
Thanks, Ashley. Hello. So as Ashley said, you can leave it back on that integration slide for a second. I'm Louisa O'Mara, and I'm coming to you from Northern Arizona University in Flagstaff, Arizona. And I'm one of the evaluation leads for CHRs with us. So I'd like to talk about, as she said, some of the important work our cohort has done and continues to do around promoting improved integration of CHRs into their tribal healthcare systems and teams. And even though we're presenting this separate from sustainability, which Ashley's going to talk about next, we really consider all of this integration work to be essential to elevating CHR programs' success and effectiveness and sustainability in their communities around the state. Next slide, please. So first off, we've recognized from the beginning of the grant that each of the CHR programs in the cohort had their own unique expertise in different areas, and that expertise could benefit the others. So we developed what we called a program-to-program mentoring model, where CHR programs volunteered to be matched to learn from each other. So there have been 3 partnerships so far that have taken place either through a series of Zoom meetings, or in the case that you see pictured here through a combination of both virtual and in-person site visit. And the model just had to be flexible because while site visits are like the best, Arizona is a really big state, and you saw in the map that Ashley showed that some of our programs are located more than 7 hours away from each other. So as part of evaluation, we asked the participants after the fact, like what their programs gained from these mentoring relationships. And they reported making improvements in things like record keeping, budget tracking, identifying and managing grants, and getting new ideas for strategies related to clinical and community engagement. Next slide, please. Next, I want to talk about our CHR integration toolkit. And this is actually a series that we have developed over the past 3 years, led by the evaluation team here, but working in really close collaboration with the CHR program partners, the Advisory Council on Indian Healthcare, and other stakeholders such as Indian Health Service consultants, policy experts, and clinical staff at tribal serving health facilities. So the first two, whose covers you can actually see here, they're currently available on our website, and they're also on actually the Envision resource page. But because our website is undergoing a major redesign right now, the other two won't be available until kind of the end of August, beginning of September. So each toolkit in the series focuses on a priority area that was identified by our partners at the beginning of this grant. So you can see that they are focused on these 4 areas of CHR integration. So into public health emergency preparedness and response, vaccine deployment, healthcare teams and systems, and high risk and palliative care coordination. So the goal of this series is to provide both the justification for improving CHR integration into these really important service areas, and also to provide the tools to help make it happen. So they contain things like reflection checklists to help a program or health system assess their readiness to change. They're also going to have PowerPoint templates that folks can download and adapt to present to leadership or stakeholders in their communities, and links to download and access tons of really helpful resources. So if you're interested, just bookmark the website here for NAU Share website, and check back in September when you can access the entire series, and we'll let Envision know so they can post it on their resources when they're done as well. Next slide, please. So I included this slide as just a sneak peek at one of the interesting tools that we developed that's included in the toolkit. So most of our CHR program partners do not actually have access to the electronic health record that's utilized by the health facilities in their area. So they had no really good way of tracking referrals made and received by their programs. So whether with healthcare providers or social service agencies that they work with to coordinate care for clients and their patients. So we worked really for about 2 years with a data analyst and with one of our CHR program partners who was piloting this to design a Microsoft Excel-based referral tracker. So it includes some really useful auto-generated data visualizations like the pie chart you see. And now we have several programs using it. Seems to be working, and we're really excited to share the resource as part of the toolkit. Next slide, please. And so the last thing I wanted to talk about before passing it back to Ashley is just a few of the really neat integration-focused events that CHRs with us has coordinated. NAU facilitated a great 2-day workshop pictured on the left that brought together the Hopi Tribe CHR program and cancer support services to strategize on how to improve cervical cancer screening in their community. On the bottom right, you see a flyer for an amazing conference that was organized by CHRs and community health nurses at Salt River Pima Maricopa Indian Community near Phoenix. And that brought together experts from around the Southwest to discuss and learn about improving care for patients experiencing serious illnesses in tribal communities. And in the center, and in the photo of Commander Haven speaking, you see a recent statewide conference that we organized in May, and I'll post a link to an article about it if anyone wants to read more about that. And that event was the first of its kind in Arizona, so we're really proud of it. It brought together tribal public health and healthcare leaders, licensed providers, billing experts, and CHR program leadership and staff from Arizona's 19 CHR programs for this day of learning and planning for CHR workforce development and sustainability, which is a perfect segue to the next section where Ashley is going to describe some of our efforts specifically focused on sustainability. Next slide.
Okay, we're going to pause for just a second. We're having some issues with the translation or interpretation channel, and so we want to get that fixed for all of our native Spanish speakers who are wanting to follow along. And so to do that, we have to stop the slideshow for a second, and everybody bear with this, take a minute break, get something to drink or whatever. We will get this fixed so that we can continue.
We should be all set to continue. So Louisa, you can take it from there. Sorry for the interruption.
Well, that's all right. If you want to go to the next slide, I'll just hand it back to Ashley.
Awesome. Thanks, Louisa. So now we will talk about sustainability. You can click to the next slide. So as I mentioned before, the AACIHC has continuously supported the CHR workforce since 2015. Our previous director, Kim Russell, and some of our very own CHR grant partners pushed very hard to advocate for community health worker voluntary certification here in Arizona to ensure that legislation was inclusive of tribal CHR context and that the IHS CHR training qualified for one of the certification requirements. In 2018, the Arizona legislature passed a law establishing voluntary certification for both CHWs and CHRs. So through this grant, we supported the majority of the CHRs at partner programs to receive this voluntary certification. We have about 40 plus CHRs who are currently certified, and we provide a lot of technical assistance and guidance for the CHR workforce around the state to better understand and access the certification. So the most recent development, which was made possible by the establishment of voluntary certification, was that our state Medicaid agency began approving reimbursement for CHW and CHR services last year. So our agency and our grant cohort have worked very closely to create resources and trainings to support CHR programs to begin billing Medicaid. This includes one-on-one assistance, small group workshops, and big events like the one Louisa actually mentioned, the one that we held in May. This is such an exciting development for increasing the sustainability and integration of CHR programs in health systems. You know, so far, one of our grant partner programs is just about ready to start billing, which will actually make them among the first in the state to do so. And we have several more who are currently working on it. Next slide, please. So we want to thank you for letting us present to you today, and please reach out to Louisa and I if you have any questions or concerns or comments. Thank you.
Thank you so much, Ashley and Louisa. My apologies, I totally forgot to introduce the two of you. So I just wanted to apologize on my behalf. That was my fault, so sorry about that. But thank you so much about telling us about the CHR programs there in Arizona. And we love that toolkit that you all created, and we've been using that as a guide to also create some of the content here in Wisconsin as well too. So you all have been inspiring some of us here in the Midwest. With that being said, I would like to transition to our last presenters. So we do have the Rhode Island Department of Health here joining us. So we have James Day, who is the Health Program Administrator from the Rhode Island Department of Health CHW initiative. And then we also have Lena Roman, who is a certified CHW and a bilingual program coordinator. And then we have Sil Navasite, who is the Behavioral Health Program Manager of the Department of Housing and Human Services for Rhode Island. So I'll pass it on to Rhode Island to tell us a little bit about what they're doing.
Good afternoon, everybody, and we appreciate the invitation to come and speak with all of you today. My name is James A. I'm the Health Program Administrator at RIDO and an ally. And next slide, please. And as was mentioned, we have Lena and Sil. Today in this short presentation, we wanted to explore the role of the State Department, the Rhode Island Department of Health, or RIDO, in strengthening cross-sector connections, define principles that support our system, and identify practices that encourage CHW voice and leadership through our strategic planning efforts. Next slide. A little background on the Rhode Island Department of Health and the journey that brings us here today. Rhode Island has one statewide Department of Health. 80 to 90% of RIDO's funding comes through federal grants. There is no state set aside for CHW work or our CHW Association of Rhode Island. But one strength RIDO does have is the ability to fund partners through grants, facilitate conversations, and to convene stakeholders. For decades, RIDO has actively worked to integrate community voice into how it develops and implements public health policy and programs. And Rhode Island residents have always taken on CHW roles. And the Rhode Island Department of Health has a long history of elevating this workforce. In 2010, the Rhode Island Maternal and Child Health Center here at RIDO, community-based organizations and clinical practices created the Pediatric Enhancement Project that developed peer navigators who could assist families. In 2016, we saw the establishment of CHW certification, which is done through the nonprofit Rhode Island Certification Board. So certification of CHWs is not done nor officially tracked by the state of Rhode Island like other health professionals. Can you all hear me okay? I'll continue on. In 2017, the Community Health Worker Association of Rhode Island moved to Rhode Island College as a long-term steward of the organization and is the main trainer of CHWs here in Rhode Island. And I see Sarah Lawrence, the director, on the webinar today. And 2022, the authorization of Medicaid billing through our SPA services was passed, a step toward CHW sustainability. And the CCR grant over the last 3 years has really helped us move this work forward. We're able to fund 11 health equity zones, 10 community-based organizations, and multiple strong partners. You can, you know that thing, what I'm trying to say?
QR code.
Thank you so much. The QR code will bring you to our CHW webpage on the RIDO site, which is something brand new and came about through the CCR grant. Next slide. The CHW strategy team, our state coalition, was in place before the CCR grant. And this is part of how we qualified here in Rhode Island for both the B and the C components of the grant. The mission of the CHW strategy team is to serve as a liaison between CHWs, employers, and policymakers to champion and align varying goals and interests. And at the beginning of this grant, we probably had about 20 people that have been coming to our strategy team. And over the course of the grant and the work that we're doing, especially on our roadmap process, which we'll talk about in a second, we actually have grown from an average attendance of in the 60s. And during our roadmap process, we had between 70 and 110 allies and CHWs engaged in the roadmap process. Our strategy team focuses, as you can see, on these 4 areas. And right now we're at 46% CHWs. So we're getting close to that 51% that we have a goal for. Next slide. The strategy team, after meeting for about a year on this grant that I've been involved, really came to the conclusion that they wanted to get past just meeting, updating, talking, sort of preaching to the choir month after month, and they wanted to get into an action-based process. So we hired We in the World to come into the work. I'm going to put their We in the World, and over a little over a year, and we're still involved with implementation practices. We went through a process of engaging CHWs and allies in one-on-one meetings, large group meetings where our kickoff was 110 allies and CHWs, and to small monthly meetings where implementation teams got together to really move the work forward to build a robust and a sustainable workforce here in Rhode Island. 7, next slide. And these are some of the principles that you'll see through our national landscape model, is the importance of having place-based comprehensive role connected. What are the things that make a strong CHW, robust CHW? What are the principles for making that workforce sustainable and robust in Rhode Island? You'll see shared stewardship and governance, place-based coordinating infrastructure, financial sustainability, equitable policies, and equitable measurement and data systems. Next slide. We reached consensus on defining the CHW role aligned with the APHA definition, principles that the role be comprehensive using the C3 project, and the roles and responsibilities, knowing that we have a place-based and a person-based approach. So our health equity zones are really place-based, but we also have community-based organizations like the Autism Project that focus on a specific population and are statewide. So we have both the place and the person-based approach. And then we focus on connections at all levels, using CHWs to not only be forward-facing, but also bringing their experience and expertise back into policy tables and organizations to inform how and where we work. So right now, you'll see a QR code for our full roadmap report on the slide. And the implementation teams that we have working now are implementation 1, to grow the CHW role, 2, develop the CHW workforce, 3, create sustainable payment models, and 4, to coordinate community infrastructures. So that's a little history of what Rhode Island has been doing and is doing, and how we're working towards that strong and robust CHW workforce. And now I'd like to introduce Lena, who's one of our CHWs on the grant. Next slide.
Good afternoon, everyone. My name is Lena Roman, and I'm a community health worker certified that works for Integra Care of New England. And as a CHW, I connect communities to resources and build the trust needed to advocate. I'm a member of the CHW strategy team and active in the roadmap process and implementation teams. My involvement with the RIDO CHW initiative has given me the opportunities to build my leadership and advocacy skills. I would like to highlight some of the work that I've been doing. In leadership, I'm the founder of the Latin CHW support group that has been growing up in the last 2 years from 4 members to 36 people from multiple organizations. I helped design and deliver the first 2 annual CHW conference and the state, facilitating workshops too, and took an active role in workforce development, becoming a training and many public topics that I done it. I contribute to a state CHW awareness campaign. As you will see, there's 2 links for the videos. That was an excellent project from RIDO. And in advocacy, I use my voice and advocate for food insecurity in Rhode Island. I recently developed a project that I'm trying to eliminate barriers for CHWs facing that when we're going to obtain food from the food pantries, we don't have to do lines in there or wait for other people to give us the space, and so we can serve better to our patients and clients. Presented the CHW perspective at the Action Day and the State House. And also I call the attention from the director of the local food pantry who connect me with the other director from the food bank in the state. And that was a big goal for me. And we exchanged so many ideas, and they are trying to collaborate in my project. And I participate in a link for these campaigns is below in the project. So I think at the end of the chat, you will see little links that you can see my project. Thank you.
Thank you, Lena. Now, you have to check out her videos. They're so good. She's part of our CHW campaign, which went through a multi-month research project with CHWs and allies to really build a CHW communications campaign here in Rhode Island. And the logo you see with the sun and the CHW on the bridge, Rhode Island's Community Health Workers, Your Bridge to Better Health, is just one of the assets that came out of that project. Next slide, we introduce Sil.
Thank you. Hi, my name is Sil Namrangsuthi, and I'm also a CHW. I work for the City of Providence, and our city supports different programs that promote the CHW workforce. We have programs to promoting a dual certification. For example, we have street outreach workers that reach our underserved populations that are certified, and as well as licensed as a community health worker and peer recovery specialist. The City of Providence also brings artists together, strengthening connections with local government officials and community health workers to foster equitable recovery and improve well-being in our communities across the country. Although our programs with the city are not funded by the CCR grant, I was invited to the group. I was invited to connect and collaborate with the CHW state roadmap through lead community health worker Soinette Salazar. And this is just a prime example of working outside of our silos. So I started attending the conferences, the first annual CHW conference, and then the second one this year, joined different trainings, as well as participated in different work groups, such as the strategy team and roadmap conversation. And through all these different networking opportunities, I engaged with CHW statewide. I built relationships, and I also shared experiences. The collaborative efforts, shared resources, and the experience that I had from this just priceless. And we have, with the different collaborations that we have initiative with the One Nation, One Project that brings the artists together. And also with that, our cities are also invested into, oh, thank you for sharing the link. So that's part of our initiative. And we also use our funds, it's part of like ARPA funds, to embed community health workers into our public housing facilities. So that is putting CHWs, embed them and get it staff into our public housing sites. And this gives residents the access to mental health services, behavioral and physical health services, and address the negative impacts that COVID-19 pandemic had on them. All right, thank you.
Thank you, Sil, for sharing. We thought it was important to have Sil come on because she was not one of the 11 health equity zones that was funded, and Providence wasn't one of the CBOs that we engaged, the 10 CBOs that we engaged. But it's a prime example of CHWs just working organically with each other and not worried about silos and which program they're in, but really their extreme goal of connecting not only with their community, but other CHWs statewide. It's been awesome to see that happen throughout Rhode Island. Thank you.
Thank you so much to the Rhode Island team. And I do really want to elevate that piece you were talking about, James, is all about that collaboration between CHWs and CHW allies, and really emphasize that relationship piece. We talk a lot about CHW sustainability here, and its relationship is what we begin with when it comes to sustainability work. So with that being said, I'm going to pass it on to Yasmin to share some resources with us.
Thanks, Mungshi. So once again, I'm Yasmin Aftahi. I'm the Envision Resource Coordinator. And what I've really been focusing on over the past few months here at Envision is distilling the work that has come out of the past 3 years, and what we have learned and what resources have been developed, and distilling it all and being able to provide it to all of you as you think about CHW sustainability and sustaining the programs that you all are building. And so I just wanted to quickly share a few things, and given that we are kind of using this as a transition point to really wrap up this chapter of Envision and look forward, this is a great way to continue to stay plugged in with Envision and with all of the resources that are coming out of this work. So we have shared this before in a past webinar. So if you haven't seen this already, Envision has a CHW vetted resource database with a ton of capacity building resources. It's really visually easy to use. There are different categories, keyword searches. So everything that we have discovered and shared and talked about over the past 3 years is in this database. So make sure that you check that out. An example of how this might look moving forward is sustainability resources on the Envision website. So if CMS is putting out new information, that's where we can share it. So please go check that out. We also have included resources from the CHW Sustainability Summit that Envision hosted in April in Spokane, Washington, that are available publicly. We recorded all the keynote sessions and plenaries along with their slides. Those are available on the Envision website, as well as the participant guide and summit journal that we gave to everybody who came to the summit. It's full of amazing pieces pulled from the Community of Transformation curriculum, which is really rooted in sustainability. And there's just lots of different worksheets that you can work through to do things like inventory or relationships and things like that. And then in the back of the guidebook, you'll find an overview of 13 national partner organizations, who they are, what they do, why it matters to the CHW workforce, and key resources and where to go read those. It includes organizations like the American Public Health Association, NACHWA, the National Association of Community Health Workers, and lots of other important partner organizations that you can go learn about. And then I also lastly, but not leastly, want to remind you to go to myenvision. myenvision is a community platform that we developed as a place for CHWs and allies across the nation to share resources with one another, upcoming events, and really engage in peer-to-peer connection. And this is also going to be a heavily utilized space as Envision moves forward as a way to continue to connect and share. So if you're not a member of myenvision, please go join. Join some of those virtual poster sessions that we talked about earlier. Definitely go check that out and continue to plug in Envision is definitely only hitting our stride with developing and sharing and disseminating awesome resources around CHW sustainability. So these are all the different ways to get plugged in. And as always, if you want to share resources or talk about resources or any of these different databases and how to use them, you can always get in touch with me. Yasmin, I'll make sure to put my information in the chat. Next slide, please. I think I have some visual resources to share. So this is an example of what the resource library looks like. The different categories are on the left. Louisa and Ashley shared a lot of great information about their CHR work in Arizona, and this community health representative pamphlet is one of their resources. It's on the Envision database, so you can go read that in full. And we have also linked out to other databases that already exist from partner organizations like C3 Council or NACHWA. Next slide, please. And these are just some snapshots from the participant guide and reflection journal from the summit, just to give you a visual. The middle is an example of an overview of a partner organization, C3. And there's relationships as a source of power and lots of different worksheets to really understand and inventory your relationships, and sustainability goal setting to kind of help you start to map out what your sustainability plans could look like. And again, our keynotes and plenaries, some examples. North Carolina is a great example of a local or a state health department, a state CHW association working with a state health department to really develop a sustainability plan in collaboration with each other. That's an awesome one. And Denise Octavia Smith, who is the executive director of NACHWA, who, if you've ever heard her speak, is an absolute powerhouse. Someone once said they wish they could bottle Denise, so that they could take her everywhere to advocate on behalf of the CHW workforce. So consider this a bottle of Denise. So definitely go check those out and get in touch if you have any questions. Thanks, Mangshi.
Do you want to talk about the virtual poster?
Yeah, we mentioned this at the
Okay.
beginning of the presentation, but just another reminder, these are the upcoming poster sessions where Washington County Ambulance District from, oh wait, they already did theirs, Kentucky State Cabinet for Health. So the Kentucky team will be sharing more about their communities and work on August 1st. So we'll see you there at myenvision.
Thank you so much, Yasmin. So we do have 10 minutes for Q&A. So if you all would like to ask our presenters question, please feel free to raise your hand and I will call on you, or also type it into the chat. So here's your time to ask our presenter questions. Or if you have comments, comments are also welcome as well too.
Hello, this is Patrice. Someone had asked me earlier, as far as Austin, and our diabetes program, is it just offered to Austin residents? And I did type in the chat that yes, it's only offered to Austin and Austin Travis County residents. So just wanted to put that out there.
Thank you, Patrice. I know someone asked about the tracker for Louisa. So if you are also interested on the tracker, Louisa did drop in the chat. That's part of the toolkit. And if you want to connect with her more, please feel free as well.
I'd love to ask a question about that. If any employers were involved in the creation of that tracker, or was it just a CHW outward product creation?
Just for the CHR program themselves was
See,
involved in
right.
testing and designing it. We did you know, show it to Indian Health Service, some consultants to get their feedback on categories and things like that, but it is not meant to be a communication that providers would use too. It's
Oh,
just,
for like closing the loop on a referral.
It's just, yeah, so it's just for the program itself to track its own closed loop referrals, which is still really helpful. Obviously, it'd be nice if it could have input from providers, but
yes,
that's
because
not
we're
how-
doing something in Rhode Island here, trying to do the whole thing, and woo, it is challenging.
Yeah,
But I'd love
we
to
have that.
to
Yeah, the
see
health
that.
information exchange here is trying to do that too, but that's
Mhm.
very tricky in tribal communities. So,
Thank you. I did have a question for Puerto Rico. Transportation clearly is such a huge problem, and the road infrastructure. And I'm wondering if part of your CHW stretch, and I know it's very ambitious, is getting into the policy realm on, infrastructure, and budgeting for that and improving that.
Hello. I don't know if you got to, if the translation got to our team. And Esther and Malta, do you have any reaction to that?
Sí, la pregunta es más bien si contamos con o tenemos iniciativa para llevar esta situación a nivel de política pública, para que mejoren nuestras carreteras. Al momento no se está trabajando, simplemente llevamos lo que es servicios médicos, estas charlas educativas, pero sería muy interesante, ¿verdad?, desarrollar una agenda para poder llevar esto a nivel de política pública.
Sí, and our project has not specifically ATIMEDIC, but the Puerto Rico Public Health Trust has a coalition of community health workers which are advocating for policy regarding community health workers specifically. But yes, there are some structural issues that need attention, and we are not working on that directly.
So hard to do everything, of course, and you have the best roads in Rhode Island.
Can you repeat that?
I can't hear anything.
Okay, thank you so much for those questions. Does anyone else have any additional questions or comments for our presenters? I know it's a quiet group today.
We're wrapping up the poll. We're also wrapping up this webinar. Appreciate you all for joining us today. But as it is the last webinar of the 2109 chapter, we're going to take a moment to think about when we started this in December 2021 was our first webinar. And Caitlin has a song that we kicked it all off with, which we think is appropriate, and she can put it on because we consider this family. And what I'd like you to do is come off of mute, get on your camera when the music starts. Because when we leave family and we say goodbye, we don't mean goodbye forever. We mean until the next time we see you. And that's what this is all about. We will see you down the road in some other iteration. And again, thank you for showing up all these times and today in particular. And let's dance a little and go into our days with a bit more joy, because who doesn't love to dance? Take it away, DJ Caitlin.
I just want to say really quickly that it is bittersweet for me to not say that I will see you all again next month, but I will see you all again soon. So really, I just want to thank all the participants, all the presenters, and all of our attendees for always joining us each month in our webinar. So yes, pass it on to Caitlin to put on music for us.